to have her sit as close to the table as possible, so she doesn't hang over. She doesn't go like this, okay? Because you want her to be up. There you go, but you also want the wrist to be free. Okay. So, oops.
Sorry. So then,
Okay.
since I'm doing the wrist.
You're doing the wrist. Now remember what we said about the wrist. Where's the wrist? Right there. So, to feel and feel, you're going to, go ahead.
Stabilize here.
Stabilize. You want to move the wrist. You want to move at the wrist. So you want to move.
Oh wow.
You want to move as close as you can. You want to have your hands to the joint space. So you can feel what's happening. Basically, between those four fingers. This is where it's happening. And there's a lot of bones there. So the
hands
first.
are so much bigger than yours. Like I feel like my fingers are getting in the way because my hands are so large.
So then you have to move.
I can slide a little
You have to move a little bit up. Yeah. Okay. If you have tiny hands, you could do it this way. So it depends a little bit who you are, how you're going to do it.
Mm-hmm.
So if I was to have started to do the end feel and I realized that my hands are getting in the way, I can restart that and you're not going to like mark us down for repositioning, right?
No.
Okay.
I'm going to mark you down if your hands are not, if you're rushing, if you go like this. Okay, this is end feel. That is not okay.
Mm-hmm.
I'm going to mark you down if you're here or if you do this. Okay? Because I have about 15 bones in between where I'm supposed to feel.
Gotcha.
I'm going to isolate the movement. That's the term. Isolate the movement and go slow enough so you can actually feel it.
Mm-hmm.
Correct. Okay?
That's
It's
cool.
very important because you have people that have all kinds of complaints and you see nothing go wrong until you feel it.
Mm-hmm.
You have people that have no complaints, and fine, until you isolate the movement and then you see and feel it. That's why you have to have those cumbersome positions. You just want to isolate the movement. Because we as people naturally make the compensations necessary to function.
Mm-hmm.
Okay?
Now, do you want us to, if we were to do it, I asked her to do the active range of motion, and then I did the end feel, and then I measured.
Yeah.
So you want us to do like all one side first, and then say, now I'm going to switch to the other side, and then we would do all the other side.
Correct.
Okay.
Yes. Yes. You always have to give me the idea that you want to test the other side. At the lab practicum, you will most likely not do both sides, but you're gonna practice and remember to say that, so you don't forget that, because you'll be amazed how many times people forget to test both sides.
Okay. Yeah.
Okay.
Cool.
And then if we're having them, so say they're doing shoulder flexion, should we have them do shoulder flexion while standing before they're in the supine position?
I think that's a good idea, because it's very difficult when you're upside down to mimic what somebody is doing standing up.
Okay.
Okay, so the patient comes in, you have them sit down, we're going to do shoulder abduction, so this is what we're going to test. This movement, okay? And we're going to do that in laying down position, okay?
Okay.
But you want to give them that kinesthetic sense of the movement that you're going to
Oh,
do.
okay.
So you have to experience the movement. This is the movement, okay?
Okay.
So if they do the active range of motion standing up, do I need to also have them repeat it laying down? No.
You don't have to. Yeah. Because you're going to see, what you're going to so when you see something, you ask somebody to do a reduction, and they go funny, or they go, who knows what they're doing. You want to make sure that they have a good sense of exactly what you want.
Mm-hmm.
You always want to go to the end. And if they stop here, so before you lay them down, you're going to ask, can you move a little further? Can you move your elbow towards your ear? Okay?
Mm-hmm.
You want to get a good sense of what they can do.
Okay.
Okay? Because that's going to dictate what you're going to, where you're going to have that end feel and how far you're going to